premenstrual syndrome, or PMS. Premenstrual syndrome, PMS, is a combination of changes that many women experience about a week or two before their period. PMS symptoms include physical changes, such as acne, feeling bloated, tired, as well as emotional or mood changes. The menstrual cycle affects women in different ways and may cause mild to severe discomfort. Symptoms usually disappear as soon as the cycle begins. Possible causes: most women notice some changes before their period begins, but for some, these changes cause discomfort and affect their daily and routine lives. If these premenstrual changes are difficult for you to deal with, you can see a doctor for premenstrual syndrome. Premenstrual syndrome may be caused by hormonal changes during the menstrual cycle, fluctuations and changes in the brain chemical called serotonin that may also cause premenstrual syndrome. Risk factors: there are certain factors that increase the risk of premenstrual syndrome. Personal or family history of depression or mood disorders, family history of premenstrual syndrome, smoking, alcohol intake, any physical or emotional trauma you have experienced. Signs and symptoms. Symptoms of premenstrual syndrome include physical, emotional, or behavioral symptoms, pain or bloating in the abdominal area, constipation or diarrhea, inflammation of the breasts, acne, pooping, discomfort, anxiety, depression, or excessive sensitivity to light or sound. Changes in sleep patterns, cravings for food and sweets. Diagnosis. Your obstetrician-gynecologist will discuss your symptoms, so premenstrual syndrome will be determined if you have more than one recurrent symptom. The timing and identification of symptoms will help diagnose and determine if these symptoms are related to premenstrual syndrome, as these symptoms usually disappear when your period begins, and your doctor may need to rule out other conditions that appear in similar symptoms. Treatment options. Your doctor may prescribe medications to reduce your premenstrual syndrome depending on your symptoms and diagnoses. So these medications may include pain relievers, anti-inflammatory drugs, antidepressants, or diuretics, which help you get rid of excess fluid. In some cases, hormonal contraceptives may also be prescribed to stop ovulation and relieve PMS symptoms. Frequently asked questions. Q. Does exercise help in treatment? A. Yes, exercise will make you feel better, as research has confirmed that exercise helps reduce PMS symptoms. Brisk walking, running, cycling, and swimming are outdoor exercises, and these boost the endorphin, which may reduce pain associated with premenstrual syndrome. Yoga is also very useful for reducing menstrual pain, cramps, and bloating. Q. Does diet help relieve symptoms? Yes, you can treat the symptoms of PMS with some dietary changes, such as eating small meals often instead of large meals may reduce the feeling of bloating, and fruits, vegetables, and whole grains help you feel better. It's best to increase your intake of calcium-rich foods, such as dairy products, but limit your consumption of caffeine and alcohol. Q. Do birth control pills help in treatment? A. Once you start taking hormonal contraception, your hormone levels become more predictable, and the symptoms of premenstrual syndrome decrease, and other problems such as irregular menstrual cycles, heavy menstrual cycles, and cramps also decrease with birth control pills. Also, in some women, the fixed hormones of the pills reduce the emotional symptoms of premenstrual syndrome.